Whooping cough. The name may sound harmless, but when prevention fails, it can lead to life-changing consequences. So why are these complications still happening? Even though a vaccine is available, waning immunity. Immunity from childhood vaccinations decreases over time, leaving teens and adults vulnerable. Low vaccine uptake in pregnancy. In England, maternal vaccine coverage dropped from 75% in 2017 to 59-66% in recent years, leaving more infants unprotected at birth. Delayed infant vaccinations or missed doses. Infants depend on timely vaccination. Any gap increases risk. Misdiagnosis or delay. Early symptoms look mild like a cold, so diagnosis may be delayed until complications develop. The real cause of complications isn't just numbers. It's lives changed forever.